As we do each week, we will begin with a report on the Berks County COVID-19 data. That's going to be presented by Brian Gottschall. Brian is the director of the Berks County Department of Emergency Services. He is also the team lead for the Berks County COVID-19 leadership team. Brian Gottschall.
Good morning, Commissioner. Thank you. Give it a moment for the screen share to come up. Okay. Yes, our report for April the 8th. Continuing, unfortunately, with the bad news that we've had to report over the last few weeks. For the few weeks prior to that, I was kind of feeling good about getting to do this every week because we were getting to give positive news. But the news is not quite so positive as it was those 3 or 4 weeks through February into March. So this is the state's early warning dashboard for last Friday. We show upward trends in all of the indicators that are measured on this dashboard. Again, I want to temper my comments. You know, it definitely is a turnaround from where we had been going. I don't think that it's a catastrophe. I don't think that we're seeing vertical slopes in any of our indicators, but we're definitely seeing week over week upward trending indicators, which is not at all what we would like to see. Our case count and testing both are in an upward trend. Again, we have folks going for testing, presumably because they've been notified they have an exposure or they're symptomatic. We think it's unlikely that there are a lot of people producing just for testing because they're bored and don't have anything to do on a Saturday afternoon. So both the indications with respect to folks going for testing as well as the positive cases being diagnosed from that testing are indicative of an upward trend of COVID in the community. Likewise, our first test positivity, as we always mention, this positivity percentage is different than the states because we're looking not at the serial testing, much of which is negative, going on in nursing homes and other custodial care facilities. This is just kind of live in color testing from folks turning up at doctor's offices, nursing care at the hospital, whatever. And we see that we're maintaining above that 40% number again now, like we were back in the beginning of January after the holiday season. Fortunately, our deaths continue to remain fairly flat, but I think that I'm not going out on a limb because we do get to see kind of the daily information. And obviously, it takes a number of days or a number of weeks even of bad information, of undesirable information, I should say, about deaths to really show a movement on the graph. But I think that those that are seeing these on a daily basis will acknowledge that we are seeing larger numbers on a daily basis than we had been seeing for a number of weeks. And as we point out each week, the deaths are lagging indicators to the cases. Obviously, somebody isn't diagnosed positive and then they die the next day. It takes a number of days. There's perhaps a hospital stay, and then we see the death number start to go up. So again, emphasizing to the public that the end is kind of in sight here. We're doing really great as a society. We're getting vaccine out on the street, but we need folks to kind of batten down the hatches and do what we've been asking them to do for many, many months now for just a little bit longer to try to keep the case numbers tamped down. And I'll talk about that in a moment at the end of why it's so important, because I've had some personal conversations with folks that kind of just don't understand why this is critical at this juncture. We see our hospital numbers continuing to trend up. Again, I don't want to give anybody the impression that we're in a crisis or the hospitals are being overwhelmed. That's not what we're saying, but we're seeing ongoing upward trends in all of this data week over week. Our county comparison snapshot remains relatively unchanged in the 3-week view that we look at it with respect to both the tests administered per capita, the cases per capita, and the deaths per capita. So, you know, we're holding our own. Other counties are as equally good or as equally bad as us, but we're all universally across the Commonwealth looking worse in all of these statistics. Before I talk about vaccines, I do want to take a moment and just talk about why this whole continued effort at mitigation is so important. I've talked to people in my own personal circle who say, well, you know, the end's in sight, vaccines are coming out. Yes, some more people are going to get COVID, but we're not seeing the death numbers like we saw back in the spring of last year. So what's the big deal? And the big deal is that every person who contracts COVID now represents kind of a petri dish in which that COVID virus has the capability to change, mutate, become one of these variants that we're concerned about. And the good news is that with respect to most of the variants that have been identified, and I'm talking worldwide, it appears as though the vaccines that we have are reasonably effective. There's one out there that's a little bit of concern, but across the board, the vaccines that we have appear to be reasonably effective against the variants that have been identified. But every time a human body is infected with COVID, it's an opportunity for that COVID to mutate. And, obviously one person is just one person in the big mix of all of the COVID cases out there. But if we each think about our own personal responsibility in not becoming that person, in doing everything we can to ensure that those in our close circle aren't becoming infected with COVID, that of course amplifies across the county, across the state, across the nation, and across the world. And this is why, even though we have vaccines out there that are getting administered with increasing frequency, even though we do believe the end is in sight, we all have a real strong personal responsibility to do everything we can to not let the wheels come off the wagon by having a variant develop that the vaccines are not effective against. So I apologize for that digression, but I felt the need to kind of justify a little bit of what we're asking for, merely because I've heard pushback about this in my own personal circles. So moving on to vaccine administrations, last week in Berks County, we were 10th in the Commonwealth by partially covered and 13th in the Commonwealth by fully covered. A little bit of an improvement this week to 9th and 12th in those two categories. I don't expect that we're going to see this staying the same or see Berks's position continue to remain the same, just due to some information I'm going to share a little bit later. Vaccine opportunities, again, showing the state GIS map that they improved a few weeks ago that makes it a little easier to read and focuses on first doses. In the last week, there were 23,600 doses received in Berks County among 20 different providers. That number does reflect both first and second doses that came into the county last week. Our weekly eye chart of all the providers in Berks County and how much vaccine they've received throughout the entire vaccinating effort. And our weekly breakdown, again, reiterating what I said last week, I've taken weeks 1 through 6 and combined them in the top row just because the chart was getting too big to show on one page. And I felt that that data from back, 6 weeks ago was less important. But what we can see is a continuing upward trend in the number of vaccine doses coming into the county, because we are looking at first and second doses here. Because the state has level set us at around 12,000 doses, and then we add on the doses that are coming in through the Federal Pharmacy Partnership Program, the very small number of doses that we're seeing coming into the chain pharmacies. I think that this is about where we're going to end up. Probably a little bit higher than this because of the Federal Pharmacy Partnership, but if we're getting 12,000 new doses plus those FPP doses every week, and then once we get to the point that we're getting the second doses that are based on that 12,000 allocation, in essence, 4 weeks ago, I think in the next 2 weeks or so, we're going to see this number continue to rise a small amount, but then level off, and that's going to be where we're going to remain until the state cuts loose larger amounts of vaccine coming into our county. This takes a look at our cumulative dose per capita that we've been looking at through week 16. Again, just as a reminder, those counties in blue are counties that have health departments. We see that the top 10 most populated counties in the state, with the exception of Lehigh, continue to lag considerably in the dose allocations per capita. However, we do see when we look at the individual weeks more recently, and in this one we're looking at last week, which is week 16 of the effort, we see that those numbers look somewhat better, although still not where we as a populated county would like to see them being. But again, as I've said, it's going to take many weeks of these marginally improved numbers in the bottom chart to make significant changes in the cumulative numbers in the top chart. So our wrap up for this week is just to help folks to understand how to best go about finding a vaccine. Go to www.doyourpartberks.com, hover over the COVID vaccine in the header, and click on the COVID-19 vaccine information link. That takes you to a page that Steph Weaver, our public relations person, is managing, where she's trying to aggregate all the information about the local providers, as well as there is a link out to the Vaccinate Lancaster site, which is our regional vaccine center as defined by Department of Health. So again, it is right next door in Lancaster in the neighboring county. I understand for some people that travel is not realistic and not doable. That's the reason we're continuing to try to emphasize on Berks County opportunities, but it is a large amount of vaccine coming into that single site with, I'm going to use the term vast, that may not be a term that everybody agrees with, but a vast number of appointments available each week. So folks that are reasonably able to travel to Lancaster to the Park City Mall can take advantage of that regional vaccine center opportunity that DOH is flooding vaccine into for Lancaster County and the county surrounding that facility. And that concludes our report for this week, Commissioner. Certainly willing to answer any questions, but that's all I have to say.
Thank you very much, Brian. Is there any question or comment from my colleagues?
I'm impressed he has that down to 10 minutes now.
Experience. It's a great
That's right.